Hello everyone, Dr. Sunil Dand, the lost art of listening in medicine. Fewer things could be more important than being a good listener if you work in healthcare. I know that we work in a fast-paced environment, especially in a hospital, and there are tremendous time constraints, but we must never forget the importance of simply listening to our patients. As the famous saying goes, if speaking is silver, then listening is gold. There have been some very interesting studies done that have shown that doctors interrupt their patients only a few seconds into the patient speaking. The last study result I saw was 11 seconds, that was it, that the patient had to speak before the doctor interrupted them. I've seen other studies which show even less time, several seconds only. This is not a good thing, and I think it's getting worse in our modern, fast-paced, high-tech world where doctors spend so much time staring at screens. There are lots of other non-verbal cues as well that every doctor should be utilizing. Eye contact. Who wants to have a detailed discussion about their health and not even be looked at by their doctor? We have to be looking at our patients, not the screen. Facial expressions, obviously that's out now with us all wearing masks. Sitting down, that's another big one, especially in the hospital. Frequently the interaction will occur with the doctor towering over their patient. But there was one really fascinating study done that showed that when a doctor simply sat down, patients perceived them to be in the room for longer than the doctors who stood up, even though the study showed that they were in the room for the same amount of time. Patients also reported that when doctors sat down with them, they had a greater understanding of their condition and a more positive interaction in general. I believe it was Hippocrates, the father of medicine, who once said, "Cure sometimes, treat often, comfort always." And listening is a key part of the comforting process for any clinician. It's also vital when you're trying to exhibit compassion and empathy with the patient. So if you are in healthcare, whether you're a doctor, other clinician, or even a nurse, first and foremost, your job is to be a good listener. Thanks everyone for listening. Dr. Sunil Dand. Do hit the subscribe button down below for more similar videos. We will talk again very soon.